AIDS. It's a word that's carried a lot of fear, stigma, and misinformation over the years. But what is AIDS really? And what should you know about it today? Let's break it down together. AIDS stands for Acquired Immunodeficiency Syndrome. It's the most advanced stage of HIV infection, HIV being the human immunodeficiency virus. When untreated, HIV slowly destroys the immune system, leaving the body unable to fight off infections or certain cancers. That's when we call it AIDS. So, what are the symptoms of AIDS? You might be surprised to know that they're not always obvious at first. AIDS usually develops after years of untreated HIV. Some common signs include chronic fatigue, just always feeling tired, rapid weight loss, frequent fevers or night sweats, and swollen lymph nodes that don't go away. Other symptoms can be persistent diarrhea, white spots or strange lesions in the mouth or on the tongue, skin rashes or bumps, shortness of breath, or a cough that just won't quit. People might get frequent infections like tuberculosis or pneumonia, and even experience memory loss, confusion, or depression. These symptoms happen because the immune system can no longer protect the body from opportunistic infections or certain cancers. But how is AIDS diagnosed? There are two main ways. First, if someone with HIV has a CD4 T-cell count below 200 cells per cubic millimeter, normal levels are 500 to 1600, that's a clear sign. Second, if they develop one or more AIDS-defining illnesses, these include diseases like tuberculosis, a type of pneumonia called PCP, Kaposi's sarcoma, invasive cervical cancer, and some serious fungal or parasitic infections. Doctors use a few different tests: HIV antibody or antigen tests, CD4 cell counts, and viral load tests, which measure how much HIV is in the blood. Now let's talk prevention. The best way to prevent AIDS is to avoid HIV infection in the first place, or to manage HIV effectively if you have it. So how do you prevent HIV transmission? Use condoms during sex and don't share needles or syringes. Get tested regularly and know your partner's HIV status. For people at high risk, there's a medication called pre-exposure prophylaxis or PrEP that can help keep HIV at bay. If you think you might have been exposed to HIV, there's also post-exposure prophylaxis or PEP, which you need to take within 72 hours. Healthcare workers follow strict safety guidelines too, like wearing gloves and disposing of needles safely. And for HIV-positive mothers, proper treatment can prevent passing the virus to their babies during pregnancy, childbirth, or breastfeeding. If you already have HIV, the key to preventing progression to AIDS is early diagnosis and sticking to your medication. This is called antiretroviral therapy, or ART. Now here's some good news. While there's no cure, HIV and AIDS can be managed as chronic conditions. ART is a combination of drugs you take for life. It suppresses the virus, helps the immune system recover, and can even reduce viral levels so low that they're undetectable, meaning you can't transmit HIV to others. That's the U equals U message: undetectable equals untransmittable. Opportunistic infections are treated with antibiotics, antifungals, or antivirals, and cancer may require its own treatment. Supportive care matters too. Good nutrition, mental health support, and a strong community can make all the difference. Let's sum it up. AIDS symptoms include things like fatigue, weight loss, infections, and skin problems. Diagnosis is based on a low CD4 count or certain illnesses. Prevention: practice safe sex, don't share needles, consider PrEP or PEP, and stick to ART if you're diagnosed. Treatment centers on lifelong ART and managing infections or complications. AIDS doesn't have to be a death sentence. With the right information, prevention, and treatment, people with HIV can live long, healthy lives. If you want more resources or a printable guide, just let me know down in the comments. And remember, knowledge is power. Take care of yourself and each other. Today, we're going to explore one of the most important health topics of our time: AIDS, or acquired immunodeficiency syndrome, and its relationship with HIV. AIDS is the most advanced stage of HIV infection. HIV attacks the body's immune system. Specifically, it targets CD4 cells, also known as T cells, which help fight off infections. When HIV severely damages the immune system, the person develops AIDS. Early HIV infection often appears as flu-like symptoms 2 to 4 weeks after infection. These include fever, sore throat, fatigue, rash, swollen lymph nodes, headache, and muscle aches. As HIV progresses to AIDS, symptoms become more severe and persistent. These include rapid weight loss, recurring fever, extreme fatigue, and opportunistic infections. HIV is transmitted through blood, semen, vaginal fluids, rectal fluids, and breast milk. The main modes include unprotected sex, sharing needles, mother-to-child transmission, and blood transfusions. Once inside the body, HIV targets CD4 cells, uses them to replicate itself, then destroys these cells, weakening the immune system progressively. HIV diagnosis involves several types of tests, starting with antibody and antigen tests. These detect antibodies or P24 antigen in blood, with results in minutes to days. CD4 cell counts help determine disease progression. Normal levels are 500 to 1600 cells per cubic millimeter. Prevention includes behavioral strategies like using condoms correctly every time during sex. Limiting sexual partners, getting tested regularly, and avoiding needle sharing are crucial. Medical prevention includes PrEP, a daily pill that reduces infection risk by up to 99%. PrEP provides emergency protection within 72 hours of exposure, and treatment as prevention means undetectable equals untransmittable. Antiretroviral therapy, or RT, is a lifelong treatment using combination drugs. ART suppresses the virus to undetectable levels, allowing people with HIV to live long, healthy lives. While there's no cure yet, research continues for vaccines and potential cures. Some functional remission cases give hope, though they remain very rare. Remember, early symptoms can be flu-like, diagnosis involves multiple tests, transmission occurs through specific body fluids, prevention is highly effective with proper precautions, and treatment allows people with HIV to live normal lifespans. If you have concerns, consult healthcare professionals and get tested. Knowledge and early action save lives. Stay informed, stay protected, and support those affected by HIV and AIDS. Did you know that over 39 million people around the world are living with HIV today? Brief explanation of what the video will cover. Why this topic matters: stigma, awareness, prevention, and treatment. Full name: Human Immunodeficiency Virus. What it does? Attacks the immune system, specifically CD4 T cells. Difference between HIV and AIDS. HIV is the virus. AIDS is the final stage of untreated HIV, how the immune system is compromised over time. Number of people living with HIV globally, approx 39 million as of 2023. Highest prevalence in sub-Saharan Africa. Progress in treatment and reduction in deaths. Mention of UNAIDS or WHO data for credibility. Through bodily fluids, blood, semen, vaginal fluids, rectal fluids, breast milk. Common ways: unprotected sex, sharing needles or syringes, from mother to baby during childbirth or breastfeeding. Blood transfusions, rare today due to screening. HIV cannot be transmitted by hugging, kissing, sharing food or drinks, toilet seats, or mosquito bites. Condom use, male and female condoms. Pre-exposure prophylaxis, PrEP. A daily pill for prevention, post-exposure prophylaxis, PEP. Emergency pill within 72 hours. Regular testing and monogamy, mutual partner testing. Clean needle programs. Antiretroviral therapy, ART. Keeps viral load low, allows people with HIV to live long, healthy lives. Undetectable equals sign untransmittable, U equals sign U. Concept: people on ART with undetectable viral loads do not transmit HIV. Common myths to debunk: HIV only affects gay people. HIV is a death sentence. You can get HIV from kissing. You'll know if someone has HIV by looking at them. Modern treatments allow people to live normal lives. People can work, have children, and maintain relationships. Importance of mental health and community support. Celebrities and public figures living with HIV. Stigma can prevent testing and treatment. Educating others is key to breaking stigma. Importance of empathy and support. Get tested regularly. Educate others and share the video. Support HIV/AIDS organizations. Link to resources, for example, local clinics, support groups, UNAIDS, CDC, WHO,